Hello, my name is d.hadaway, a founder of CallMyDokter here in Indonesia. Today I am presenting an overview of a telemedicine platform we have developed here in Indonesia. I have been in the consumer experience business for some 35 years and work extensively in healthcare environments. Of this, around 15 years in Indonesia. My interest in telemedicine arose around 5 years ago when I was building community health clinics. Since returning to Indonesia in 2017, I have been broadly engaged with digital technologies and specifically how to apply to Indonesian patient experiences. What is striking is many of today's experiences are about any doctor, but many in the community are looking for a higher quality engagement. Their history, secure video and records, online vitals, monitoring by My Doctor. The My Doctor is able to engage proactively with a quality engagement is becoming non-negotiable. This presentation is designed for parties and health providers interested in our B2B platform as a service or a B2C health engagement model, or a mixture of both. Our journey over the next 10 to 15 minutes is a brief introduction to CallMyDokter, a platform as a service business enabling doctor practices, supporting multi-service health providers like hospitals with the tools demanded by patients and doctors. In the interest of the doctor, patient, and service provider, these players today operate often independently. With modern technology, desires and expectations of patients and doctors, demand for better quality assessment, different ways to support chronic diseases, aged care, and the many interactions, there are demands for different ways of treatment and monitoring. With COVID, telemedicine is no longer a choice, and globally we are seeing most specialties changing the way they interact with patients online. My experience with health policies is that some 80 to 90% of these policies were covering outpatient services and costs. This has the hospital-centered model under pressure. Over time, the 30,000 rupiah chat also will be seen as inadequate for many patients. Signs are the whole landscape of health delivery has and continues to change. Over the past 5 years, we've seen telemedicine evolving, and it's interesting to see which areas were being used. Prescriptions, pre- and post-op appointments from hospitals, caring for aged patients or sick children where medical records are critical, ongoing care for chronic conditions. Each of these are where the health record is core to the ongoing successful support to patients. This is not inconsistent with today, but we are seeing more specialties finding new ways to engage. Then consider the gaps in today in Indonesian landscape due to the basic design of most telemedicine offerings here. This leaves a gap in the market for CallMyDokter. Objectives of connected care and patient experience are solving the continuum of care issues patients have dealt with for years. Better quality, access, efficiency. Now with technology, it is about the ability to connect, receive personalized quality consults with my information and delivery of the needed additional services. This connectivity is a bit like a phone number. First mover advantage will matter. When we reflect on the area health services, Traditional providers are like hubs of services supporting the doctor in a 5 to 10-kilometre radius. Disruption will occur. Hospital and some service providers, enabled by the grabs and gojacks with logistics, will become the efficient community support hubs, attracting services that were previously taken by small pharmacies and other small players in the area. This leads us to consider the role of the platform as a service in supporting outpatient engagement. Here we refer to two models: the provider clinic or hospital with its in-house medical record, being able to reach out to patients or patients reaching into the clinic. The second model is the doctor clinic. The doctor requiring support for scheduling medical information with HIPAA quality secure video and seamless access for referring services. Both have one thing in common: the patient. This leads us to the journey we see emerging for 1. The service provider, in-house doctors, and 2. Home doctors, and possibly being the clinic doctors, being supported outside the clinic environment, but still respecting the need for a service provider and other service needs, the referrals, and seamless patient care. Fundamentally, is about supporting the doctor in the engagement. Core medical information, schedule quality video, vitals, patient history, and seamless referrals. When you get the chance of walking through a CallMyDokter engagement, you will see the online engagement mirror that of a clinic. It also comes with the SMS and email reminders and payment functions to make the journey complete. We also seeing companies needing telemedicine support. Protocols, understanding employee health are now more than ever tied to productivity with workplace health and safety requiring medical judgments. For companies never engaging in medical support, a telemedicine platform provides an efficient support on site to management for proactive health and safety. What have we done? We have taken a successful international platform, undertaking thousands of consults with hundreds of doctors, its HIPAA compliant video, and its tools and support. We have taken the patient view and created journeys relevant to Indonesia, from illness or identified vital problems to doctors and delivery of services. Our future is incorporating more IoTs and online virtual monitoring, as well as working with professional medical groups as to further online protocols for chronic and other medical specialty management. Our third thoughts on vital monitoring is moving us to the next stage of support for patients and doctors. We recently identified and linked into an online monitoring opportunity which will see you work through your mobile phone and provide us medical grade reads of BP, pulse, blood oxygen, stress, heart rate variation, among others. This leads us to the next level with monitoring opportunity of patients or employees without the many gadget devices needed for these vitals. And of course, it will be proactive support of patient awareness of their health. Our business model, we start with connected continuum of care for the health ecosystem, B2B and B2C. We provide doctors with what they need for a quality online engagement with their patient and access for referral to local service providers. We support onboarding with efforts, including onboarding companies to raise opportunity for service providers and doctors. We have a series of tools supporting patients and doctors, and an economic model supporting the entire ecosystem. This all sounds good, but still decisions on the journeys are to be taken. We need to clarify your journey. We need to understand what issues you're trying to solve, how to deal with things like medical information across the different users, payments, scheduling, use of white label, encouragement of Call My Doctor, and your priorities. Who are we? We're a new venture in Indonesia, with all the licenses obtained in July. In addition to myself, the platform developer, we are locally supported by Arya Setiadharma, the ex-chairman of Astro's son, who is also an avid investor in digital technology, including Clue, the smart city solution in Indonesia. Our medical team is led by Dr. Yunawati, who has extensive hospital experiences and an avid promoter of telemedicine. Thank you, and I look forward to engaging and hearing from you. I hope you are as excited about what is happening in telemedicine as I am and its potential. For more detailed slides, please let us know and we will send them on request. Thank you.